The UNTHSC Interprofessional Student Coalition hosts faculty and students from the medical school, PA, PT, public health, graduate biomedical sciences, and TCU nursing and nutritional science programs to a roundtable discussion on obesity. The goal of this dynamic discussion is to allow students to learn about, from, and with each other in discussing an integrated healthcare team approach to obesity.
The point of this discussion is actually to get us all in the room and really talking about a central topic. Most of us are kind of confined to our particular programs, and we don't have the ability for an outreach into the other programs. And so this is kind of an attempt to try to facilitate that type of discussion and replicate what we might expect to experience as practicing professionals in the healthcare system. One of the things that we do is promote this interprofessional curriculum, and secondly, we are attempting to unify community outreach projects.
I want you guys to think about the topic of obesity, but then apply it to your different professions. So if you can just talk about what you do now currently in your profession for a patient or for the topic of obesity.
And also too, from my perspective in nutrition, people don't realize what they're eating, and we've got to turn things around so that people do understand that they can get healthier options at home instead of always going out. The food desert, I think, is a big problem in a lot of places.
What do you mean by the food desert?
It's a term that the U.S. Department of Agriculture uses for areas, specific geographical areas, where there is no access to grocery stores or healthy food choices.
What I feel like is the uniqueness about a PA is more opportunity to spend time and build relationship qualities, and through that counseling, getting them to change themselves.
It shouldn't be one specific person that does the education to a patient about nutrition. It should be each practitioner every time you come into contact with the patient.
So unfortunately, in the beginning, there was obesity research that I know of in physiology standpoints, but over time, it transcended to not being any more obesity research, for it's on the lab side.
Most of my nutrition came from undergrad as a kinesiology exercise science major, so the nutrition was a part of our curriculum. But, you know, when you go to a doctor, when you go to a PA, when you go to a pharmacist, you get medicine and you take that medicine. But when we prescribe treatment, it's exercise.
So with our help, we can understand what's going on in the communities, and therefore create programs and other things to help combat obesity.
We talked about with the School of Public Health, they have a huge impact in the community on getting the information and education out to these patients early.
Public health is important to spreading the education, which is the best thing to fix the issue. And then the research and PhD department is going to be there to give us interventions or newer interventions and innovations to help fix the problem.
I think it's really important to see that we each have valuable roles on this team.
With time, we're learning that we depend on each other in preventing diseases and keeping society healthy.
Anytime we can get together, I think it's very imperative that it just fosters that team approach.
I think these type of discussions are great. We really don't get a lot of interaction with other disciplines, so having nurses come in, and a lot of times nurses aren't included on these type of discussions, and it's more at the doctoral level. So it's great to see these different types of candidates all coming together.
We do hope to present another dynamic discussion maybe after the summer. Hopefully you've now met some of your other students in the other programs, and if you see them in the hallways or in the library, you have a common theme or topic, and you maybe collaborate on something in the future. But just this whole networking aspect of getting out and meeting members that are out on the rest of the campus.